Good afternoon. Goeiemiddag. Dumelang. Sawubona. Molweni. Ndimisiari. Injenga. Wrong speech. I'm Corné Nel, Faculty Student Advisor and Honorary Bell Ringer at OSCEs. The students will understand that. It is my honor to welcome you to this unusual, extraordinary and unique solemn declaration ceremony of the class of 2020. What a year! The official welcome will be done by our Dean, Prof. De Jager, but please permit me a few words. It was a tough year for everybody in the whole world, but we have survived. It was tough, but was it all bad? Didn't some of you wish for some time for yourself? You wished for more time to spend with your family? Maybe you wanted to read some books or learn something new? Well, your wish was granted. I'm not ignoring the negatives. Some of us lost loved ones. Some suffered emotional breakdowns. Some had serious physical challenges. Others were hungry, and that was devastating. But for us to continue, we need resilience, and we needed the ability to adapt. And all of you taking this declaration today proved that you are indeed resilient. Now you can go out and make a difference in people's lives, wherever you go. Well done. Also, a special mention to the staff of the BCMP program. Talk about resilience. Some even taught classes from hospital beds. A huge congratulations to the program managers, the coordinators, the lecturers, the clinical facilitators, and the peer mentors of the class of 2020. Now, it's my pleasure to introduce you to our resilient and charismatic Dean, Prof. Tiaan de Jager.
Welcome to the School of Medicine's virtual declaration ceremony at the University of Pretoria. I am Tiaan de Jager, Dean of the Faculty of Health Sciences. A special welcome to the Vice-Chancellor and Principal of the University of Pretoria, Professor Tuana Coupe, the University of Pretoria Senior Executive Members, the Faculty of Health Sciences, EXCO, family and friends of our graduates, the faculty and all students who will be taking their respective declarations today. The Faculty of Health Sciences at the University of Pretoria is honoured and proud to bear witness to this special occasion. Today, as you make your declaration, you begin a new chapter in your life. This commitment assumes the responsibilities and obligations as a healthcare professional. Soon you will receive your degrees and you will join over 300,000 graduates as part of the UP alumni community. The COVID-19 pandemic has brought forth many challenges, but the Faculty of Health Sciences quickly adjusted to the new normal using technology and innovative methods to ensure successful teaching and learning. The average module pass rate in the faculty increased from approximately 94 to 97%. It is a clear indication that the future of healthcare in South Africa is in good hands and that our students are more than capable of delivering exceptional academic performance, even during unforeseen circumstances. At this stage in your career, it is important to embrace the South African philosophy of Ubuntu. I am because you are. When you choose to embody the spirit of Ubuntu, you take on qualities that include empathy, compassion, kindness, and generosity. As life changes, I have no doubt that you will make a positive impact in society by striving to improve the lives of those around you. By taking this declaration, you take an oath to have the utmost respect for human life. Congratulations.
Thank you, Prof. De Jager, for such an inspirational message. Next, we would like to welcome Prof. Marilou, the coordinator for the BCMP program, to lead the declaration.
Dear graduates, I invite you to declare with me. Upon receiving my degree in clinical medical practice at the University of Pretoria, and upon my entry into the clinical associate profession, I declare solemnly, I will continue the age-old tradition of healthcare and of service to humankind. I will value and respect human life. I will practice my profession faithfully, honorably, and with professionalism. I will respect all members of the healthcare team and together strive to maintain high professional standards. I will maintain and protect patient confidentiality and in all cases will conduct myself in an ethical and professional way towards my patients. I will continue the high standard of training received from my university through lifelong learning in order to remain a competent practitioner.
Thank you, Dr. Lowe, and congratulations to the new cohort of clinical medical practitioners. Next up, we have Prof. Jannie Hugo, Professor and HOD of the Department of Family Medicine at the University of Pretoria, who will give his address to our new clinical medical practitioners.
Ladies and gentlemen, Dean, Head of School, parents, and clinical associates, colleagues, it's a pleasure to attend this ceremony and having the opportunity to say a few words. It is fair to say that life has changed more in 2020 than in any of the other 64 years that I've lived, and we have survived. I want to encourage you that you are moving into a world where your skills will be more needed and more valuable than you are aware of. The world needs people who can deal with uncertainty, be adaptable, and people who can learn while they work. And you have demonstrated that in your ability to navigate the BCMP course with the challenges of self-directed learning and having to survive a rural area and survive different learning and different working situations, more than can be said of many other students. You also, in this year, had to learn how to function in a virtual world and how to integrate the virtual with the actual world. And you did it successfully. Congratulations. 2020 is also the year in which we, as a department and a research unit, has employed more clinical associates than ever imagined. In 2019 already we partnered with Anglo-American Minds to assist the Department of Health in the implementation of COPC, Community Oriented Primary Care. We started with a 3-clinic area in Mogalakwena in Limpopo, and the implementation is built around the work of a clinical associate. One of our previous students, Chiku Matlala. We could immediately see how the clinical associate profession fits into the role of a COPC practitioner. Building relationships, understanding situations at home, at the clinic, working with community health workers and the clinic staff, working with community organizations and churches, and coordinate care from home to clinic and hospital. All became natural to Chico. And then, in the new year, we were hit by COVID. The mines were very vulnerable for this epidemic, and they saw the work that we had done. And within 2 weeks, we agreed with Anglo American on a huge ongoing partnership with their mine group. In this project, we now employ more than 70 clinical associates. This is to assist in patient care, home care, and facilitating COPC practice. The initial indications are that this is hugely successful. The clinical associates, who are trained in all 3 of our BCMP universities, namely Walter Sisulu, Wits, and UP, are making their mark as excellent COPC practitioners. And coming from diverse rural areas, learning and working in different situations, and doing self-directed learning, clearly prepared these practitioners for the work. We have, though, had to do specific COPC training, but they are learning and developing fast. This has shown us how versatile the clinical associates are. Firstly, we as a department did the first large-scale substance use program in the country through COSUP with clinical associates. Now we do the first large-scale focused integrated COPC implementation in a partnership between the private and the public sectors, again with clinical associates, and it is looking good. This is giving us the courage to plan to expand the platform of the BCMP course more formally into COPC, substance use, and district practice. Watch this space. I trust you will find your place in the world and develop more than you imagined, and keep the oath that you are taking today. Congratulations again. Thank you.
Thank you, Prof. Hugo, for your inspirational address. Now we will have Prof. De Jager, Dean of the Faculty of Health Science, and Prof. Robin Green, Chairperson of the School of Medicine, sign the agreement. Thank you, Prof. De Jager and Prof. Green. Now I would like to take this opportunity to welcome Ms. Zuki Chabalala, Academic Coordinator for the BCMP program, to announce the prize winners.
Good afternoon. Thank you so much for joining us, and I'm proud of every single one of you for having made it through these 3 years, or 4 or 5, of the BCMP program. It is my honor and my pleasure to be able to announce the prize winnings for this year's graduating class. First on the list is the Mpumalanga Council of Family Physicians and Prize for the best performing student in a rural district in the 3rd year of the course, Ms. Gina Mkunu. The Bookmark Prize for the 3rd year student who demonstrated the best leadership qualities is Ms. Baba Mashabela. And this year we had 2 leadership awards. The next one, also a Bookmark Prize for the 3rd year BCMP student demonstrating the best leadership qualities, is Ms. Shani Bwota. School of Medicine Prize for the best academic achievement in the final year of the course. Congratulations to Ms. Relebohile Mabina. F&B Prize for the best academic achievement over the 3 years of the course, Ms. Shani Bwota. Congratulations to all of you.
Thank you, Ms. Chabalala, and congratulations to our students. We are now close to the end of the program. I would like to welcome back Dr. Lowe to do the acknowledgements and closing for today's virtual BCMP ceremony.
Dear graduates, now at the end of this virtual momentous occasion, we can address you as graduates. Even more, we can talk to you as clinical associates, fully qualified clinical associates, ready to enter the South African healthcare service. In closing, I want to acknowledge all of you for the hard work you've done over the past 3 years. Although for some it was 4 years, for maybe 1 or 2 it was 5 years. You focused, you worked, you studied new knowledge, you learned new skills. Even in the face of COVID-19, you were willing to go back to the hospitals, to go and learn from patients. And for that, we acknowledge you. Even though you learned so well, I want to urge you, never, ever stop learning. Always focus and learn. Continue to pursue new knowledge. Learn better ways to help people. Bring more healthcare to people. Bring more health to more people in a more caring and more person-centered way. Lastly, we would like to thank all the people who worked hard to make this virtual event not only possible, but also beautiful. Thanks to Prof. Hugo for his address to inspire the graduates on their journey. Thank you to the other participants. Thank you, Prof. De Jager, Prof. Green. Thank you to Ms. Cornynel. Thank you to Ms. Zuki Chabalala. And lastly, thank you to Mani Buikanyu from the Marketing and Communications Department at the Faculty of Health Sciences, and to Louis Kluter Productions for producing the audiovisual material presented today. Go well and serve the people. Thank you.